The night Michael Jackson died was a moment that left the world in shock. On June 25, 2009, the King of Pop, an icon whose music and performances had captivated generations, was found unresponsive in his Los Angeles home. The immediate cause of his death was a powerful anesthetic called Propofol, a drug typically reserved for surgical procedures. The person who administered this drug was Dr. Conrad Murray, Jackson's personal physician. But the story of how Murray came to be in Jackson's inner circle, and why he administered a dangerous drug outside of a medical setting, is a tale of secrecy, deception, and questionable medical practices. In the early months of 2009, Jackson was preparing for his highly anticipated This Is It concert series in London. The shows were meant to be a comeback for the pop star, who had been out of the public eye for several years due to legal troubles and health issues. Live, the concert promoter, was under immense pressure to ensure the success of the tour. Jackson, known for his perfectionism and high standards, demanded the best, including a personal physician who could cater to his specific needs. This is where Dr. Conrad Murray entered the picture. Murray, a cardiologist from Las Vegas, was not a well-known figure in Jackson's inner circle. Despite this, he claimed to have been Jackson's personal physician for months, a fact that was later disputed by many, including Jackson's own team. The question of why Murray's involvement was so shrouded in secrecy, and why Jackson's team seemed unaware of his role, is a complex one, but it begins to unravel when we examine the timeline and the relationships Murray had built. In February 2009, Dr. Arnold Slavitt, a cardiologist, conducted a medical evaluation of Jackson. During this evaluation, Jackson mentioned that Murray had been his personal physician for about 2 months. This statement was significant because it suggested that Murray had already been treating Jackson before he was officially hired for the London tour. However, when Murray was later questioned by the police, he claimed to have been working for Jackson for only a little over 2 months, starting in April 2009. This discrepancy raises questions about the true nature and duration of Murray's involvement with Jackson. To understand Murray's relationship with Jackson, we need to look at his interactions with Tim Lopez, the owner of Applied Pharmacy Services in Las Vegas. Applied Pharmacy Services was a compounding pharmacy, which means they specialized in creating custom medications for patients. In November 2008, Murray called Lopez to inquire about a cream called Binaquin, which is used to treat vitiligo, a skin condition that causes loss of pigmentation. Jackson was known to suffer from vitiligo, and this call suggests that Murray was already treating Jackson, even if not officially. Murray's interest in Binaquin was followed by a series of phone calls and orders from Lopez's pharmacy. In March 2009, Murray called Lopez again, this time asking about the availability of Propofol, a powerful anesthetic. Lopez confirmed that he could provide the drug, and Murray placed an order for a significant amount of Propofol, along with other medical supplies. This order was delivered to Murray's mistress, Nicole Alvarez, in Santa Monica, rather than to his office in Las Vegas. This move suggests that Murray was trying to keep his actions hidden from others, including Jackson's official medical team. The question of why Murray was so interested in Propofol is critical. Propofol is a dangerous drug that requires careful administration in a medical setting. It is not a drug that should be used outside of a hospital, and certainly not for sleep. Jackson had a history of insomnia and anxiety, and it is believed that he had been using Demerol, a powerful painkiller, to help him sleep. However, Demerol had side effects that Jackson found unpleasant, and he was reportedly interested in finding a better solution. Propofol, with its rapid onset and quick recovery time, seemed like a potential solution. Murray, knowing this, may have seen an opportunity to ingratiate himself with Jackson by providing the drug. Murray's relationship with Jackson was not just medical, it was also personal. Murray had introduced Jackson to his mistress, Nicole Alvarez, and the two had a close bond. Murray's decision to have the Propofol delivered to Alvarez's home suggests that he was not only trying to keep his actions secret, but also that he was using his personal relationships to facilitate his medical practices. Live, the concert promoter, was initially reluctant to pay for a personal physician for Jackson. However, they eventually agreed, partly because they hoped it would reduce Jackson's dependence on Dr. Arnold Klein, who was known to prescribe Jackson powerful drugs. Murray, who was recommended by Jackson, was hired for the job. However, AG Live did not conduct thorough background checks on Murray, and they were unaware of his history of questionable medical practices. Murray's actions in the months leading up to Jackson's death were marked by a series of ethical and legal breaches. He was administering Propofol to Jackson in a non-medical setting, without the proper monitoring equipment, and without the knowledge of Jackson's official medical team. This was a dangerous and irresponsible practice that ultimately led to Jackson's death. In the end, Dr. Conrad Murray was convicted of involuntary manslaughter for his role in Jackson's death. The trial revealed the extent of his negligence and the lengths to which he had gone to cater to Jackson's demands. Murray's story is a cautionary tale about the dangers of prioritizing the desires of a powerful client over medical ethics and the well-being of the patient. In conclusion, the mystery of Dr. Conrad Murray's involvement with Michael Jackson is one of secrecy, questionable practices, and a tragic outcome. His relationship with Jackson, his interactions with Tim Lopez, and his administration of Propofol all point to a series of actions that were both unethical and illegal. The death of Michael Jackson was a loss that shook the world, and the circumstances surrounding it serve as a stark reminder of the importance of medical ethics and the dangers of compromising them for any reason.